Good evening. Welcome to a brand new episode of BMC Global Live AlHilal Health World, Nothing But Lifestyle. I am Jessila Mujib. We wish you a very happy new year filled with health and happiness. As parents, we are always concerned about the health of our children. Today we have with us the pediatrician from AlHilal Hospital Sitra, Dr. Abuzer, Surka. He comes with a wealth of experience of over 29 years and his area of expertise include pediatric infections, pediatric allergies and other nutritional deficiencies in children. To know more about the topic, let's move on to the doctor. So doctor, welcome to the show and thank you for joining us today and a very happy new year doctor to you.
Thank you so much. It is my pleasure to be on this platform. Wishing you and all our viewers a very happy and healthy 2024. And as a healthcare professional, we are also committed to make this year very healthy for our little angels. Thank you.
Thank you, doctor. Thank you. So, doctor, let's begin by discussing what are the common illnesses found in children during this winter.
Yeah, the winter months always bring some anxiety for the parents, and commonly as pediatrician and clinicians, I have come across mostly the respiratory related illnesses in children, which include common cold or the flu, which we know as cough and some throat infections, and also there are numerous cases of ear infections in children. This is all related to the change in weather, and I mean especially confined to the winter months. Because of low humidity, the viruses thrive more in the winter months, and then hence it is more common during this season. Secondly, there are certain skin related illnesses, like skin will become dry, become scaly, especially for those children who are having some allergic conditions. They may face more problems during the winter months, and hence along with the care of the respiratory system, the skin care is also equally important for children during the winter months.
Okay, now you mentioned about the allergies in children.
Yeah.
So, are allergies common during the winter? How often do you come across such conditions?
Yeah, allergies are fairly common. Actually, they are present throughout the year. There are 4 different types of allergies, just to name them. Like there is a cow's milk protein allergy, which we see in the small kids less than 1 year of age. Then comes the food allergy, which is also seen in any season, any climate. Then the winter related, as per your question, like during these months, we find more of respiratory allergies, which may be recurrent cough, cold, and also throat infections. And lastly, there are the skin related allergies, which we call as allergic dermatitis. So these last two are, more common during the winter months because of the low immune system of the child, maybe, or the child is first time getting exposed to these allergens during these months, and the child's immune system is not able to cope up with the load of the exposure, and the child may develop certain symptoms and signs.
Okay, doctor, we have a query from one of our viewers.
Yeah.
Their son is only 3 years old and mostly staying at home. But this boy is always falling sick with symptoms of cold and cough and rhinitis. But they have cats and kittens at home. So he always plays with the cats and kittens.
Yeah.
So any connection between his illness and his pets?
In very common scenario we also see in our clinics, Yes, to answer your question directly, there is a definite connection between the two, between the kittens and the allergic symptoms the child is having. Now let me explain to you what is the connection, what happens. So commonly parents feel that the child is at home and child is not going to fall sick because the child is protected, is not getting exposed to the environment. Like usually they think that the child is going to school only will catch the like cough and cold from the other kids or from the environment, but it is not always like this. In this case we see that the child is having the symptoms and child is playing with the cat and kittens. So it means that the child's body or the immune system is allergic to some component. Now what is that? That is in this case seems to be animal hair. Like it is also a very common allergen we see I see in my clinical practice over the several years. And animal hair, like cat skin is furry and it has so many hair, and the child may be getting exposed to this hair, maybe sometimes inhaling some small hair particles, and this may trigger the immune system of the child, and because of this trigger the child may develop certain allergic symptoms. These allergic symptoms are what we see now, that child is falling sick often, cough and cold, and child is not keeping healthy. So now what can we do about it? Because we need to solve the parents' query. Parents are obviously concerned my child is not keeping healthy. So we as pediatrician and we have experience in the field of allergy. since two decades. So, what we do is we first try to find out what we find at what is the particular allergen, what the child is allergic to. There are several tests we conduct to know that, and how severe is the allergy. These two things we need to find out. After we confirm the diagnosis that there is surely an allergic component in the blood and to what the child is allergic to, we can advise the parents. There are some specific medications to control the allergy first of all, plus how to desensitize the child. Because now child has become sensitive to that allergen. So, we need to desensitize. Desensitize means the body we have to get it used to the allergen and make it less reactive to the allergen. So, the child will not fall sick. So, this is how we go about it. So, there is a definite connection and it needs to be treated because the child is small. Otherwise, his allergy can progress further if it is not treated properly at the right time and can lead to some other complications later in life.
So, doctor, now you described about the connection between the allergies and pets and all.
Yes.
Now, what's your advice for the parents of young children who often fall, who have recurrent cough and cold?
Yes.
And what's your advice for them?
Sure. See, first of all, this is a very common illness we see in children nowadays, maybe because their immune systems are weak and they have become more sensitive to the environmental allergens. Allergen means a certain substance which can trigger the immune system in the child's body. So, my advice is that first of all we need to confirm that how severe is the allergy in the child and child is allergic to what particular component. And then, so therefore that the parents have to seek an expert health professional's advice who has got an experience in treating pediatric allergies. Secondly, after confirming the diagnosis, the management part goes like we have to first counsel the parents to avoid certain things their child is very allergic to for that moment, and then start the medications to control the allergy. So, this does not mean that child has to avoid those allergens for a lifetime. No, we can treat the allergy by proper medication depending upon the blood reports, and then I advise the medication for a certain period of time to control the allergy. Once the allergy is controlled, the child can go back to normal life and be like any other child, and he or she may not develop any allergic symptoms. That is the part of the medical thing. Now, coming to the parents' role, what is the parents' role in that? Parents have to take care of the child, avoid certain junk foods, give the more healthy diet to the child, which includes the fruits, vegetables, more amount of protein, because this all helps to develop the immune system in the child. No, nowadays, most of the kids we see they are more addicted to the sort of junk foods and chips packets and all those things, burgers and fries and less. See, these are not going to give any good nutrition to the child. So, keep the immune system healthy and to keep this illnesses in check, and for a child to have a healthy life, obviously food also plays a very important role in that. So, these things I would advise that first of all seek a medical expert's advice, and then also concentrate on the food part for the child. And once we confirm that there is some allergic component, need to avoid it for the time being, so that the child does not fall sick acutely, and once we start the medications and allergies is under control, everything will be back to normal.
Okay. Now, our viewers would like to know more about the vaccination for flu in children.
Yeah. See, vaccination plays a very important role for strengthening the immune system. Particularly during the winter months, there is a very common incidence of the seasonal flu, we all know that. So, fortunately in the Kingdom of Bahrain we have got a very good flu vaccine available for children. First let me explain to you when to take the vaccine, how it should be given and how frequently it should be given, So, first let us know when is the flu season. The flu season usually begins around the month of October and extends right up to March or April. Like it is a slightly pre-winter, before the winter starts, and extends right to the early summer. So, for a child to gain proper immunity and immune protection against this virus of flu, the child has to be given the vaccine 1 month prior to the onset of the flu season, means around the month of September. Because the immune system takes around 3 to 4 weeks to develop the immunity against the flu virus once the vaccine has been given to the child. It is not an immediate protection. Some parents feel they have taken the vaccine in October and my child immediately will start getting protection. No, it is not like that. Because for any vaccine, the human body needs time to develop the immune protection for that particular virus. So, this vaccine, flu vaccine, should be given to children around the month of September, and it is an annual vaccine because the duration of protection is around 12 months, not more than that. So, as we know, there are certain vaccines, they have got lifelong protection. We don't need to repeat it every year. But the flu vaccine needs to be given. And we have it available in all private hospitals. Even in AL-HILAL hospital, we have got the vaccine, and we give it very frequently to all the parents. And we also advise that taking the vaccine will help to protect the child, because it will help to strengthen the immune system of the child.
Okay. Any side effects for this vaccine?
No, this is just like any other routine vaccine. There is no major side effects. Normal, maybe some mild fever 1 or 2 days and little pain. That's all. Nothing more than that. There is no other dangerous or like major side effects which can sort of deter the parent from taking the vaccine. No, it's safe.
Doctor, we have another query from another viewer.
Okay.
His daughter is a teenager.
Yeah.
When she was around 5 years old, she used to have allergic rhinitis often.
Yes.
Now, for the past 1 year, she is having itchy skin.
Okay.
And the skin is turning very dry.
Yeah.
What's the connection between the two illnesses?
Yeah, this is also a very frequent like scenario we seen in our clinics. Like, yeah, the answer is there is a very strong connection. But what it is, the connection is like begins from childhood actually. The child had a history of allergic rhinitis, was falling sick frequently. But maybe sometimes some parents, they don't go for the anti-allergic medication or a complete evaluation for the allergy. So what happens, they just feel that when a child will grow up by 5-6 years, this allergy will go away. That's a very common myth I have heard from my patients. Like maybe they heard from someone or some place, and they think that once my child grows by 5-6 years, he or she will not have any cough and cold. This allergy will go away on its own. Now there are two things for this. Yeah, some patients, some children's this immune system will develop strong protection against this frequent allergy, and may offer protection to the child. The child may become symptom free by 5 to 6 years of age. It happens, but not in all the patients. Some patients may not develop the immunity, and then what happens? This allergy rhinitis will progress after certain years, like after 5 or 6 years. By the child becomes a teenager, it may progress to allergic dermatitis. That is, we call contact dermatitis or atopic dermatitis. So this skin is particularly very dry and scaly. The skin, there is itching more so at night, and this dry skin will be more in the front of the forearms and also in the back of the legs, and the skin folds. So the skin becomes like a skin of a snake. So it is very much psychologically also sort of disturbing for the child, especially for a girl, teenager girl. She will feel a lot of psychological issues also. And this I have seen there are several international studies also. The atopic dermatitis or the dry skin or skin allergies, they are more common in the girls. Exact cause is not known, but it is more common in the girls than the boys. So I would advise the parents, like if your child is really having some allergic rhinitis or allergic cough and cold, repeated episodes during the childhood, please get your child evaluated, and if there is some allergy component in the reports, get it treated. Otherwise, that may stop, that cough and cold may stop after some time, but that allergy component may persist in the child. And when the child grows up, again the immune system gets activated, and the child may develop the skin allergies. So there is a definite connection, and this connection needs to be treated as early as possible to avoid the severest form of allergy.
So doctor, as you are a specialist in child nutrition, we would like to know about the food habits for children from 6 months to 2 years, which will help for their optimum growth in nutrition.
Very nice question this is, because it is very important for each and every child, I would say. See, for the first 6 months, we always advise exclusive breastfeeding, that a mother has, that is the best thing. If for any reason, mother's health or any other reason, then only we advise formula feeds. That is the first thing. After 6 months, now what we should, and when to start other food and how to give. Like this will go on up to 2 years, because this period is very crucial. 6 months to 2 years, the child is also getting an optimum growth. The rate of growth is very high. Plus, the child is developing several food habits. So at this stage, if the mother takes proper care and gives the proper food at the proper time, the child will develop all different tastes. And by the child is grown up 1.5 to 2 years, he will not be a fussy eater, which we see nowadays. So many kids are having this problem. Parents are coming that my child is not eating that and not eating this, not eating fruits, not eating vegetables. This is because from the childhood, the habit has not been formed to eat everything. So, and sometimes first time mothers are very afraid also that what I should give. I can give salty things, I can say to give sour things or not this, that. So let me tell you today what we should give. So from 6 months, as we know, the child has no teeth. These are still not coming and teeth comes after 1.5 years, the fully formed teeth will be there. Like so, what is the basic principle? Give everything liquid. Don't give any solids. Right. Now what to give? Anything, any liquid. You can begin with soups, you can begin with rice water, dal water, and there are so many cultural preferences also. So you can, but the only thing is the form should be a liquid form, because the child doesn't have teeth, cannot swallow, so there will be some digestive problem. So you should begin with actually, vegetable soups are a very good source of vitamins also for the child. You don't need to give any vitamin supplements also. You can give some mashed rice, mashed potatoes, slowly begin one by one. And always remember that for the small baby, 6-month-old child, maybe what we are giving is something new. So any person, even when we try to eat some new cuisine, we take some time to develop the taste. So same for the baby. Baby takes time. So don't worry if your baby is not taking that liquid or maybe soup or juice for initial 2-3 days. But the mother should persist with it. Mother should continue with that food. So from 6 months, when you are starting anything new, let the baby give the baby some time to develop the taste, and then once the baby starts accepting one particular taste, like for beginning you are giving some salty things like soup and with some salt and pepper you can put, then go to something sweet, then go to something sour, like that. Initial thing. After that, the baby grows up and baby has got teeth and can chew something, you can give some soft semi-solid foods, and same principle, like you give all different taste. So the child will develop different taste from the beginning. He will not be not a fussy eater. Nowadays, mother wants some sort of ready-made foods available, baby foods in the market. I usually don't advise them any time in my practice, because first of all, they contain some preservatives. We all know that nothing will stay in the shelf for a long time unless it has some preservatives. Secondly, it will be almost the same taste for the child. So child will never develop that different taste what you want to develop, and then the same children will become fussy eaters after they grow up, because they are not used to the different taste. And one helpful tip I would like to give is that it is always easy to make a small baby understand and control to take different types of food. Other than a 2-year child, it becomes so fussy that you have to give in to the tantrums. There will be no tantrums in a 6-month-old child, Only the child may not accept and you may worry, but okay, you give the child the same thing persistently, the baby will accept. A 2-year-old child or 3-year-old child will not accept. He will show some tantrums, and then he will only have his or her own way, and then you give in to the demands. But that actually you are harming the child, because the child always has the psychology. No child will say give me some healthy food or no. So we have to develop those habit in the child. So that is my tip for the 6-month to 2-year-old. That start step by step. Begin with liquids, then semi-solids, then solids, and do not leave out any taste. Give all the different, what you are eating, your child should eat, in short. Only thing, the form is different, because small babies, they don't have teeth, they give the soup and liquid form, and then gradually you can switch to the solid form. But everything, what you are eating in the house, why shouldn't the child also eat? As a member of the family, same thing should be there, no?
Yes.
But sometimes mothers are also, maybe they are busy, they are working mothers, and they don't get time for the kids, So these things are actually harming the child, So I would also say now in this world and in this century, father mother both should take equal part in raising the child, and they should both cooperate to give the good and healthy food for the child and make the child. This is the basic thing. Food is a basic thing to make a child healthy.
Oh, that was very informative answer.
Thank you.
So, doctor, can you now advise the parents on the skincare routine for the kids during winter?
Yes, sure. Because winter months bring with that lot of skin problems.
Yes.
Also, skin becomes dry. So no, usually we use some moisturizer. We have got so many baby creams in the market. We can use that. Anyone is good. But how to apply and how to use is very important. So one tip also for that is that when the mother baths, we let us begin with the small babies, because small baby's skin is more sort of delicate and requires more care. So when the mother gives a bath to the baby, after bath, don't completely dry the baby with a towel, just pat dry, and leave some minimum amount of moisture on the skin. After that, you can apply the baby skin lotion, whichever brand you are using. So that will help to get the moisture locked in. That way the skin will stay very soft and will not dry up so easily. That is the first thing. If your child is particularly allergic, for allergic skin diseases, then there are also special skin preparations available for that skin, and that you can use, and that your concerned doctor will also advise how to apply that. But for routine general care during the winter months, maybe most are using the cream, but they don't know how to apply it, and then they don't get a desired effect. So this is one way to do that. Another thing is usually we keep the clothes, the whole body covered also. That is also another way. But before you keeping the body covered, let there be some skin lotion on the body, so it will help to keep the skin soft and not become dry. Another important for the hair, for the head, sorry, because the kids get many times cradle cap, because usually the mothers keep a cap on the child's head and cover the ears. But when there is a sort of more sweating in the child of the scalp region, the skin may become, on the scalp skin may become flaky and white flakes will come. That is called seborrheic dermatitis. So in those conditions, the mother should not cover the head with a cap, keep the head open and use the specific shampoos available for seborrheic dermatitis, because that is also one kind of skin allergies. These things and all these skin allergies are more common in winter. So we need to take the special care of the skin during the winter.
Okay, doctor. Doctor, what is your advice for our viewers? Or can you put all the advice you gave now in a nutshell?
Yeah, sure. Already I have given a lot of advice, but let me say it in short, that the points, takeaway points from today's talk is that, first of all, take care of the child regarding the food, healthy nutrition always gives a healthy body. When the body is healthy, there are less chances of falling sick. That is the first advice. Secondly, the skin care, proper skin care during the winter months, because child skin is very soft and delicate. We need to take proper care by the advice which I gave previously. Third is that if the child is falling sick fairly often and have the symptoms of recurrent cough and cold, or recurrent like throat infections or some wheezing, then you should immediately consult an pediatrician with having experience in treating pediatric allergies. So because it could be some form of allergy which needs to be evaluated and treated properly. This is the three main advices, and inshallah I hope that this year will be a more healthier year for everybody.
So viewers, I hope this was a very informative episode. Take into account all the tips doctor gave us. So may this new year bring you all health and happiness. And this is Jessila Mujib signing off. Good night.